We have 6 exam lanes, and this is our dry eye exam room. We've been treating ocular surface disease over the last, I guess, 10 years. At this location over here, once we've done the dry eye evaluations, we are able to help our patients out with the various technologies that are offered at our location. We have an IPL, intense pulse light instrument. We have a radio frequency instrument, the temperature NV, and we've been able to successfully use these instruments over the last 3 years to help our patients to get away from their dependency on eye drops on a continual basis. Unfortunately, there's no cure for dry eye disease, but with these instruments, we've been really able to help out our patients and take their eye health to that next level. Our patients, if they're 40 years or older, we do a OCT test on their optic nerve head and their macula to determine and make sure that they do not have any signs of any glaucoma, any signs of any macular degeneration. We also have the technology of the Daytona Optos, which gives us a wide angle image of the retina of both the right eye and the left eye that we educate our patients on. We've helped so many patients who have come in for their routine eye exams to properly, in a timely fashion, diagnose conditions like retinal holes, retinal detachments, macular degeneration, glaucoma. And we've incorporated this instrument as a standard of care into our practice. So we do this every year when we see our patients for our routine eye exams. And we also use this instrument when we're seeing our patients, every 3 to 6 months for their glaucoma or macular degeneration evaluations. And this instrument over here is the NeuroLens instrument. We incorporated this technology 2 years ago at our practice to help our patients who spend so many hours at the computer and are suffering from headaches. And we've determined that because of ocular misalignment, it can lead to a lot of these symptoms. And using these measurements, we're able to create a NeuroLens prescription to help alleviate that misalignment and improve our patients' ocular comfort. Myopia management is one of the cornerstones of our practice. And when we see a pediatric patient, we do measure their axial length. We use that information to determine if their axial length falls within the normal limits of what it should be. We are concerned about our patients. We do not want the progressive nature of myopia to get worse, and we use this instrument to determine their axial length. And we have our corneal topographer here, used for specialty contact lenses, for fits, and to make sure that our corneas are free of any pathology. All 14 lanes at our 4 locations, we use the Topcon CV5000 digital refracting system. With this system, we're able to take that information that we obtain in the pretest room to determine the patient's starting prescription, their actual prescription. And we use this instrument over here. I want to sit down over here. We use this instrument over here to then determine our patient's prescription. So one of the things that we've prided ourselves since 2008 that we've been using this instrument over here is that this, for most patients, can be one of the most stressful aspects of the eye exam because people think they're having a test, they think that they're giving wrong answers, and they're worried that their prescription is not going to be accurate. We want to alleviate that stress from our patients during this exam because this arguably can be a stressful point during an eye exam, and we want to reduce that stress level and try to eliminate it as much as possible. Several things that stand out with this instrument over here. Well, it does not look like a regular 4-opter that you've been having your eyes tested with over the last, 20, 30 years. And the beauty of this instrument is when I am testing the vision for a patient with their right eye or their left eye independently, instead of asking them what's better, 1 or choice 2, choice 3, or choice 4, I have the ability to show them 2 images at the same time. And with that, it takes a lot of the guesswork out, and it allows me to properly refine their prescription, allowing them to see as clear as possible. And we have, this is called an edger. And with this edger, we're able to edge your lenses. So if you have a single vision distance prescription or a single vision near prescription, even through your routine vision benefit, we're able to edge these lenses in office, which allows for a much quicker turnaround time. So that's the beauty in that same-day service. If there is an emergency where you've broken your glasses, we can help and take care of that problem as well.